Okay, folks, I've got a bonus one here for you. Bonus discussion G. We're discussing how medication affects folks. Particularly, I'm throwing in how it affects elderly folks. Certain medications affect people differently. So here we go with presentation G, which is bonus presentation. Okay, medication induced changes can have a can have profound social implications affecting not only the individuals taking the medication but also their families, friends and communities. Here are some key social implications. Okay, first one, strained relationships, isolation. Changes in mood and behavior can lead to social withdrawal, causing individuals to become uh, isolated from their social circles. Okay. Now, remember what I said. This is all medication induced. This is not the regular person that you're used to seeing. So, before we finish this one, you'll understand the whole gamut. So, here we go. Um, we're down to family dynamics. Medication induced changes can strain family relationships, leading to conflicts and misunderstandings. Okay, so let's say Aunt Sally takes her medication for dementia, and the medication has an adverse side effect. It changes the way she perceives everybody, and it changes her for like aggression. Okay, so it's most of the time it's the medication that affects people. It's not your loved one. They are taking in the case of dementia, they have ones to control them. Some of them have bad side effects. Okay, so we're down to family dynamics now. Medication induced changes can strain family relationships, leading to conflicts and misunderstandings. Okay, then you have work and productivity, job performance, changes in behavior and cognitive function can affect job performance, potentially leading to job loss or reduced productivity. Workplace relationships. These changes can also impact relationships with colleagues, creating a challenging work environment. Okay. Um, second page. Give me a minute, guys. Set this one down. Okay, increased stress. The individual and their loved ones may experience increased stress and anxiety due to the changes in behavior and mood. Depression. There's a risk of developing depression or other mental health issues as a result of medication induced changes. Okay. Then you have the healthcare system. Those are the folks that are prescribing your medications for you. Healthcare professionals or healthcare system. So we're going to go through that now. Increased healthcare utilization. Individuals may require additional medication appointments and interventions to manage their side effects of medications. Okay. Then you have the cost of medications. The financial burden of managing these side effects can be significant, impacting both the individual and the healthcare system. Community impact, social social stigma. There can be a social stigma associated with medication induced changes, leading to further isolation and discrimination. Then you have public safety. In some cases, medication induced changes can lead to behaviors that pose a risk to, hold on, guys. Public safety, such as increased aggression or impaired judgment. Okay, here's the bottom piece for you. Understanding these social implications is crucial for healthcare providers, patients, and their families to navigate the challenges and seek appropriate support and interventions. Do you have any specific concerns or questions about this topic? Okay, folks. So, like I said, I'm certified in elderly care. Now, I've seen the whole spectrum of care. I've been a volunteer for years in facilities, seeing how people use medication to control elderly folks. Some of those folks, they need medication for calming down, for controlling their emotions, for controlling their behaviors because of dementia or some other mental issue. Um, you know, as a elderly care specialist, meaning that I'm certified in all 6 areas of elderly care. So it's an umbrella. It's under an umbrella for me. Some of it's under gerontology, some of it's healthy aging. I guess it depends on the conversation I have with somebody. But the reason I did this show tonight for you all for extra is to explain that, if a person is on medication for pain or for anxiety or aggression, it's, if they lash out at you, it's not them, it's the medication. The medication changes who they are. In fact, that's another title of this show, medication changes for elderly folks. Because when somebody comes off of medication, depends on how it affects them too. Could be when they come off of it, it could be sweets. When they come off of it, could be anger. Just depends on how it hits them for the medication. Now let's talk about the different people. Different elderly folks have different metabolisms, different doses. So you have to figure out what kind of dose a person can take. You have to look at the dosing of the medications also. Too much can cause adverse effects. Too little cannot give them enough boost. You have to go play it by ear, see what works for somebody. You know, it's not an easy thing to adjust for somebody. But I thought this subject was important to do for folks. Hope it helps some folks figure out, how people act on different medications. Because like I said, it's important for me to do this show. I feel that this subject is very important because if you take an elderly person who's usually sweet, give them a dementia medication, and they become angry or aggravated, or do things that they don't normally do, that you're used to seeing, and this person does something in the opposite effect. It's the medication. So you have to get the right dosing for them. Those folks need the right dosing for them. Or the other option is to create a behavioral program for them. Like when you were kids, how you go to school and have chores at school. Then you'd have a chart for your chores, and you get stickers at the end of the week. So many stickers, you get a reward. That's the same principle for an elderly person's behavior. Give them a reward at the end of the week, that when they have a whole week of good behavior, then you reward them with what they like. It works for an elderly person too, because I've done it in different facilities for folks. So you can either do medication or reward system. Like I said, reward system's better, because that gives them a goal to work toward. Your whole thing as if you're an elderly specialist like I am, your whole goal is to see what works for them, for the particular person. Maybe they like ice cream at the parlor down the hall, or maybe they'll go like to the snack shop and get a hamburger in the afternoon. Those kind of things people look forward to getting. So what they'll do is they'll try and behave themselves so they can get the reward, and they get aggravated with themselves if they don't do well enough to get the reward. Trust me, it works. It's a different approach to taking care of them, but it works. Changes their mindset. If you do it every day, it's a routine for them. So what's your best thing for controlling somebody's behavior, not with medication, but with modifications, with behavior modifications. Like I said, like a goal chart. Let's have a goal for the week to hit, or let's have some um, chores that they can do around. Like let's say somebody's in a group home, and let's say Joey has a certain task to do every day. Let's say he's in charge of setting the table. Well, if he sets the table all week, at the end of the week, give him a sticker, take him out for like a reward, ice cream, shopping, something that gives them the incentive to stay in that kind of state for you. It doesn't always have to be it doesn't always have to be medication induced. You can figure things out naturally too. So that's my feeling on that. And I think that's the last one tonight for shows. I'll be on tomorrow for shows. Until then, Gator Wellness. Have a good night, folks. And like I always say, if someone has a show idea, comments about things I've done, leave it in the chat below for me, and I will see about getting you answers for your questions. For now, Gator Wellness, take care, folks.